Guess what? Third time's a charm, ladies and gentlemen. We're going over medical terminology. For some reason, one loop or another was not hooped through. So here we are at 11:30 at night, trying to get it done. Medical terminology, fortunately, is a very short chapter. Chapter is about how to create and read medical terms. Fortunately, it's a pretty simple subject, and it requires you to do a bit of memorization, that being of the Latin language, and really just Latin medical terminology, a lot of which you've already heard in your life. So this, especially if you speak a Romance language, which I'll give you extra credit if you know all 5 of them, that originated from Rome, Latin, and all of the processors, you will have an easier time remembering and understanding, ideally, because these are from your vocabulary. So when we get through this lecture, I would say a quick hint is to, when you hear the root terms or the prefixes or suffixes, think of in everyday life where you have also heard those terms being used and relate those words to the Latin prefixes, suffixes, and root terms in medical terminology. And you'll have a pretty straightforward learning experience. It's really not that difficult, but it requires a certain amount of these memorizations and then some rules along with it. Essentially, a Latin word in medical terms, or when we're describing a disease, we make a sentence out of one word by adding things to the front of it, by adding the different root term, and by tacking things on the back end. We essentially are making a long sentence out of one word. And I'll show you what I mean while we go forward here. On medical terminology, we'll continue to share. It's all of the, notice the words here, omni. That means, oh man, it's long. It's quite simple like that. To be honest, we'll walk through this and you'll see it's important for us because the more vocabulary you speak, the more medical journals you can read. And I do remember the first time I picked up Guyton's medical book and could read the same book that doctors and nurses read. It was really a wonderful moment. Wasn't much to it other than learning these fundamental terms and going to paramedic school. So we need to know this so that we have the key terms, we know the symbols, we can abbreviate and understand the abbreviations going forward, and effectively communicate with other healthcare providers when we bring our patients into the hospital. We have to be able to describe where the laceration is on the arm, how deep it goes, whether it runs longitudinal or latitudinal, whether or not the bleeding is controlled. Is it a hemorrhagic arterial bleed, or is it a superficial capillary bleed? Have we managed it with our traumatic care? And this all has to happen in 1 or 2 sentences. It's very important that we know how to speak about these things properly. So we use these in ways to illuminate about a certain disease or injury. We will use it for body positioning. We'll also use it to describe certain areas of the body or areas in the body in comparison to one another. It's essentially a new vocabulary we will be using as we go through pre-hospital and hospital care. And as you get more into the forefront, just FYI, you do see more of the English language being utilized, particularly under endocrine systems. So the question remains, why do we use Latin for all of the fundamental medical terminology? It's important to understand, communicate with each other. And that is a very good language to use for a couple different reasons. And again, I'll give you extra points if you figure that out. So essentially, as we do this, we build the term, we build the disease name from a root word, adding a prefix and adding a suffix on the other side, and some other combination of maybe in comparison to something else, or is this the first, second, or third time this has happened? Are we addressing one organ or both? We're adding a prefix to a root word, in this case, cardio. We're going to put myo on the front of it like that. And then myocardial becomes infarct. Well, what does myo mean? Myo means muscle. Cardio means heart muscle. Infarct means death. Myocardial infarction, the act of having an infarcted heart muscle, is called myocardial infarct, or MI. It's a heart attack. You've heard it a million times. Death of the muscular heart tissue. Again, we're just building this by placing something before and after the root term. It's important to know that spelling changes everything. For instance, phasia is speaking, phagia is eating. Dis means painful, difficult, or incorrect. And so dysphasia is difficulty speaking or slurring their words, or just not saying the right words. That could be they're slurring. It could be you can't think of the right, can't find the right word. You can't place it, all depending on where in the brain it's occurring. By the way, understand, if someone's slurring their words, that is a spot in the brain where the muscle nerves, the nerves that innervate and are in charge of this part of the face, are losing blood. If they can't come up with the right terms, or they're using the wrong terms, that stroke is from starving another part of the brain, the speech center that comes up with those words and those terms. That's where that stroke is occurring. Different spots. Aphasia, dysphasia is some issue with speech, whereas dysphagia would be issues with eating. So again, this could be, in fact, from people that have had strokes in the past. They lose a gag reflex, and now when they eat, they have an awful time swallowing and aspirating food. We'll hear polyphagia when you get into diabetes. This is people that eat and eat. And even as their blood sugar is skyrocketing and crescendoing at 800, 1,000 milligrams per deciliter. And the reasoning is they have no insulin to use the sugar. So they eat and eat and eat. Polyphagia. You'll hear of phagocytosis, the act of eating cells. This is what white blood cells will do to fight infection and to fight other dis-ease. By the way, look at the word dis-ease. There you go. You dis and ease. No, what the idea is, it's a difficult or a lack of ease. All right. So it's important also to know the Latin terms for human anatomy. It's also important to get these words together and understand how we can contextualize these words when we're using them in comparison to one another. So if we look at our words, let's look at the root words first. This is the big word in the middle we're going to build upon. We're going to add prefixes and suffixes to. HEPA, liver, cardio, cerebral, gastro. Of course, if you're just listening, everybody, I'm pointing to my head when I say cerebral. I'm pointing to my belly right now saying gastro. And if it goes deeper down past the stomach, the gastrum, we get to the intestinal. There's also a term for gas for stomach, which is pep. You've heard of peptic ulcers. Those are ulcers of the stomach. You've heard of Pepto-Bismol. That's Bismol, a kind of chemical that coats the stomach, the peptol portion of it. There was a soft drink made in the early 1920s that claimed it could fight upset stomach and heartburn. Guess what the name of that soft drink was? Guess what the name of that soft drink was? Prefixes are at the beginning of these words. So they usually describe location or intensity or good or bad or one or two, something specific about the root term. Suffixes, on the other end up on the back end of the word. And in those, again, it could be indicating a kind of procedure, a lobotomy, an ectomy. It could be a condition, photography. I think my house is haunted, everybody. Disease, if you have an ia or eo or a at the end of something. And then ology or logy usually. It's like the study of something, physiology. We can combine vowels, and we'll do that often if we're looking at words from one single term to multiple things that we're referring to. We usually use O's or I's or E's to do that. And we can use that when we're adding something where the root word has an ending with a consonant. We'll put an O in before we put the suffix on. So like C.A.R.E, well, I guess it doesn't really work there, but let's say pep. No, it doesn't work either. Well, if there's a Latin root term, so hep usually means liver. Hep, we add an A, hepatitis. Putting an A in there, we kind of get the rhythm of the word and fill it out with the suffix afterwards. Sometimes you add an S to make it plural. The most simplest would be lung to lungs or brain to brains. If it's a word ending in A, like vertebrae, my seventh vertebra, if I'm going to talk about 7 and 6, 5, 4, 3, 2, 1, I would say my vertebrae, first through seventh vertebrae, adding an AE to make it plural. For an IS name, we can add ES instead of IS to make it plural. What's the diagnosis? What's the diagnosis? You've had many diagnoses about this, none of which have been correct, doctor. X can become IX or ICES, the apex of the lung, right lung, would be the right pulmonary apex. If I'm going to talk about both sides, I would say the apices, meaning both apexes. The apex of the heart is not, on the other hand, we'll get to that. It's one single apex, but it's at a different position than the apices of the lungs. On or or on will be, or ia. So ovum becomes ova. Ganglion becomes ganglia. Ganglion are nerve tissues or nerve cells. US, main stem bronchus, the right and left main stem bronchus become the right bronchi, the left bronchi. And when those get smaller, we usually downsize to IOLES, eels. Bronchi, bronchus become bronchi, become smaller and become. There's a disease that children get called bronchiolitis. Guess what that's inflammation of? The bronchioles. When we look at smaller arteries, they become arterioles. When they get smaller, they turn to capillaries. And then on the other side of the web, when they're getting larger, they turn into little veins or venules followed by veins, followed by the main two veins that run up into your heart. There's also terms that we use simply to mean the first or second or multiple times that you've dealt with this. Examples for that would be unipolar, one polar, or diplo or dipolar means they have two polarities, whereas unipolar would mean one single polarity. Null means like a nothing, a no surface, or a no anything is essentially like a zero or a never. Preemie means what? Early or first. Multi, many, and bi usually indicates two. We have terms that explain color. And again, this is all Latin. Cyan or cyano is blue, usually indicates what? White. Leuco, white. Erythro is red. What does that mean? SIRRH, sear or sero. Think of cirrhosis or cirrhotic. Think of melano, or this is a dark brown. Melano, or have you heard that? Guess what color the tumors are. And finally, jaundice. And we talk about jaundice a lot. You haven't seen it until you've seen it. And when you have, you'll notice it is not simply they look a bit yellow tinged. These patients look like they've been covered in marker. In advanced jaundice, liver failure, end-stage cancer patients look like they've been painted up with highlighters. It's incredible. Now we get to little bits and directions and things that we're moving toward the body, away from the body, towards the core, away from the core. Ab means to take away. Think of abduction. When we move our hands away from the body, that's abduction. The muscles that are in charge of that are the abductors. Conversely, the adductors bring the muscles that bring the body part to the body. D means to take away or to delete. Think deletion. Circum is to circle. Circumferential, circumnavigate. You've heard these terms before. Let them inform you when we're talking about medical terminology. Peri, around, is something like around, like encircling something, not circumnavigating, but kind of close. It doesn't necessarily need to be a circle, but it is a perimeter around something. Peri, think of like peristalsis. The movement of the smooth muscle is in circular and it slides down, but it's around the perimeter of the smooth of the organ that it's contracting. Trans, what? From one to the next. Transportation, transference. Epi means whoop, above. Here's a fun one. And by the way, I do find these fun, so call me a nerd, but my mother and I would go through these when I was a kid. Epi means above. What does nephron or nephron mean in Latin? That's kidneys. Nephron means above kidneys. Well, if you were to look at the kidneys, the adrenal gland sits on top of the kidneys, and the adrenal gland produces adrenaline, which is also known as epinephrine. So adrenaline produced in the adrenal glands sit on top of the kidneys. Therefore, they are epinephrine, and they produce two drugs, norepinephrine and epinephrine. Told you it was riveting. Cool. Supra also means above, and a less direct, more general term, above. We'll go down the body, kind of looking at these. Ventral is an old term, meaning front. We've gotten away from ventral. We use what now when we talk about the front of somebody? Typically anterior. Dorsal was back. Now think of dorsal fin on a whale or a fish. Now we use, for the most part, posterior. However, there are weird spots on the body that you can't really do that with. Take the feet, for example. If I'm standing there in the anatomical position, I really don't have an anterior part of my foot facing there. My feet are flat on the ground. They'd have to be that way in order for this part of my foot to be considered anterior. Hence, we call that aspect of my foot the dorsal aspect. Underneath that is the plantar. Think of a plant planting down in the earth. Plantar, think of like if you had some kind of issue with all of those layers of skin between your bones and muscles and connective tissue, the fascia. If you had run too hard and irritated all that fascia in your foot, you would have plantar fasciitis. See how it starts to all fit together? Enjoy that aha moment. That's what you're going to get better at in class when you feel. You're going to go, oh, follow that, that aha moment. The converse of plantar would be palmar. So make sure, you have palmar, you're looking at your palms of your hands. As I said, the apex is a point, or in some cases, if it's a bone, we call it a process. Superior is anything, superior is referring to up. And by the way, you only have to distinguish between up if there's something that's also down. If there's a piece that requires you to delineate it, then you have to dig deeper and use more terminology. But it's only because it's necessary to distinguish the superior vena cava from the inferior vena cava that we have two terms for it. Because one goes above the heart, the superior is from above, coming down, and the inferior is below the heart, bringing blood up from the lower half of the body. And so we have to be able to we only have to use these terms when it's broad or vague or general or confusing to simply use one word to describe something vast or large. In other words, I could say, well, the blood's coming from the vena cava. Great. That's the whole body. At the very least, the neck down to the pelvis. Where on that vena cava? Well, the superior. Whoa. Now we already know we're talking about here. So it's only there that it makes sense to use it as such. But we don't have to break things down if they don't need to be broken down. So we use them in terms of trying to describe location. Minor and majors, you'll also hear those in terms of muscles. Usually the larger of the two, it'll be a set of muscles or organs or tissue. One of them's larger than the other. The larger will be the major. Think of the pectoralis major and the pectoralis minor. And if you want to get that sweet cut with your pectoralis, that's the minor portion that you got to work. Got to make the minor major. It's getting late and I digress. Lateral versus medial. Well, if you look at the body, this line down the middle is the midline. Anything toward the midline, vertical line down the middle of the body, medial. Anything away from the midline, lateral. Proximal versus distal. The knee is proximal to the pelvis, then the distal ankle. However, the head of the femur is proximal to the pelvis and the knee is distal. So in those two comparisons, distal and proximal can change. It's only in regard to what you are comparing in the body. Essentially, it means further from the trunk would be distal, closer to the trunk would be proximal. Usually we're talking about the main kill zone of the body, the life zone, if you will. We should think more like lifesavers and less like hunters. Deep versus superficial. Deep intends to be below certain layers of usually at least the fascia. We literally have superficial and deep fascia in our body. Superficial usually means on the outside. We usually use it kind of in a derogatory term. If somebody focuses in on the outward appearance of somebody, they're very superficial. They don't talk about very intriguing or interesting issues, somewhat cruelly in some situations. That would be superficial. Someone who's deep, that's also used cruelly in some circles too. You're being way too deep. It's just small talk. Let's enjoy our conversation. Deep means further in, and we're usually talking skin or layers of tissue. And again, we don't have to make the distinguishment to superficial if there isn't another layer more deeply set in the body. If there's nothing, you just call it, that could be the forearms fascia. Except you have to say that's the forearm's superficial fascia because we have deep fascia further in. I mentioned ventral and dorsal. And again, think of, where have you heard these terms? Fish. Ventral is an interesting one. We barely hear that. More often than not, we use anterior front versus posterior back. Now, let's get into terms. Excuse me. Flexion, bending of a joint. Extension, straightening of a joint. Adduction, moving the joint or body toward the midline of the patient. Abduction, kidnapping, moving it away from the midline. You're moving it laterally or you're abducting it. Bilateral indicates, as our body has usually a right and left coupling, that it's occurring on both sides of the midline. We have bilateral expiratory wheezes. We're hearing wheezing in both the right and the left lungs. We're seeing bilateral chest rise and fall versus we only have unilateral right-sided inhalation and exhalation. It appears the left side has been traumatized and is broken in 4 or more places on the rib cage. Thus, we're getting paradoxical unilateral movement of the rib cage. These sound really good once you start learning how to use them. For now, practice writing these down when you are writing PCRs. Afterwards, practice talking with your friends using the medical terminology. We should certainly start practicing it when we run our scenarios. When you bring your patient into the ER, mock up a 1-minute patient handover report where you incorporate some of these terms when describing the injury locations, when describing what your assessment findings were. When we find patients on the ground, they're usually either face up or face down. Face up is what we call supine. Prone is what we call face down. They could also be on what part of their body? The side, the distal side of their body, and hence we call that lateral recumbent, laying down on the side. We'll even say left lateral recumbent or right lateral recumbent. See how this all starts fitting together? Isn't that cool? Isn't that cool? Quick little tip. You come across a patient laying on their side or laying prone. You're going to C-spine them. Go over, tell them not to move, or if they're unconscious, even better. Put the C-collar on, check their neck, check their back, C-collar on, backboard next to them, roll them right on. Now we start our patient assessment with the patient already on the backboard. Start C-spining, get your good head to toe, let your crew go to work, Already we're saving time. Now, back to the show. So then there's Fowler's position or Fowler position. This is any angle of seated. Typically, we go semi-Fowlers with any conscious patient. They're not having any issues breathing, but they're conscious. And so we want them to have a clear view of what's going on. They don't need to be lying down. It's a much more informal, calming manner to have them seated, going back and forth from their home to the ambulance, from ambulance to hospital. Only in cases where they cannot breathe, or they've already stopped breathing, or they're in bad extremis, do we either have them sitting bolt upright in the case where they cannot breathe, or flat supine because they don't have enough blood pressure or not breathing adequately enough to stay conscious. And we want to work on them in their flattened condition so we have all the room to work and play as we need to. Sitting up high Fowler would be 90 degrees. That is for your asthma attack patients still compensating, your congestive heart failure patients. It's for anybody whose lungs are not working and they cannot breathe. They need to sit up in many cases because they're literally drowning in their own fluid. And it's up to us to first position them in the most advantageous place. And secondly, start dealing with the flooding inside their lungs. So we'll get into that when it comes to CPAP, when it comes to CHF. There's some really great technology from the last 20 years or so that has enabled us to do astounding things in the field with people that are starting to get pulmonary edema or have severe anaphylactic or asthmatic reactions. So high Fowlers until we get them to the hospital. Other than that, your cardiac patients, your tired patients, your sick, your patients that have isolated leg and ankle injuries, semi-Fowlers works just fine. And maybe even a cushion or a pillow for their feet or something to keep them in position of comfort, which is really what that is. So let's look at these terms together. Nephropathy or nephropathy, meaning, what does pathy mean? Usually psychopath, means disease or incorrect or wrong. Nephro, it's a combining letter. Instead of being nephropathy, we can't put two consonants together, or four in this case. It would be three in this case, my mistake. So we put the O in there to break up the two terms, the root and the suffix. And so pathy means disease, neph or nephra meaning kidney, disease of the kidney or kidney failure, nephropathy. How about this one? Dis. Think of that term. We used to say that as kids. Why are you going to diss them? I wonder if that's still around. Diss them, talk ill, or like talk smack. Talk smack, son. Dis. Bad, poor, ill-advised, not good. Dysuria usually means the condition of urine, but that now we take out the in, and urea means the condition or the substance of urine or the production of urine. Dysuria, difficult or painful or abnormal. Urine means urine, so we have painful or difficult urination. When do we have dysuria? When do we talk about dysuria? Usually two main types. We have dysuria is our uterine tract UTIs, urinary tract infections. Is that the same? Why doesn't that sound? Urinary tract infections. Urinary tract infections. The other time is STDs. Usually you will hear people with gonorrhea, chlamydia, complaining about painful urination, either burning raw sensation or glass. Feels like they're passing glass out their urethra. Doesn't sound comfortable whatsoever. Thank God we've got antibiotics because we're too stupid to remember to put on a condom when we haven't met these people yet. Thank God something else is looking out for you. But maybe it's up to you to get tested first. What do you say, gang? Oh, that's a soapbox. Sorry, I was standing on it. So dysuria is painful urination, usually due to some infection. Hyper. My kid heard that earlier and he was like, me. I said, yep. Hyper is a lot or over the top. Emesis. What's emesis? Well, we have those peach colored basins in most ambulances. Sometimes they're beige yellow, or hospitals. And you see that thing. That's called an emesis basin. Any idea what emesis is now? Hyperemesis or hyperemesis means you're throwing up a lot. Food poisoning, hepatitis A or B. Someone tricked you and gave you Ipecac syrup. That's fortunately not around either. That used to be a way that we could get people to vomit if they needed to get poison out of their body. A lot of issues with that we don't want to do any longer. Aside from that causing what? You have someone vomiting over and throwing up every last ounce of food and fluid. They become dehydrated. They are now dealing with an airway obstruction partially. If they're in any case starting to become obtunded by the toxin, they're now vomiting and having an airway issue. Not to mention if that substance was caustic. Now, not only did they drink the bleach or the floor cleaner and it burned the esophagus going into the stomach, it is now erupting back out through the esophagus and burning and causing twice as much damage. So we do not use Ipecac syrup any longer. Analgesic. Alges means pain, and means or a means not, and ick means pertaining to. So, and without allergies, pain, without pain. So an analgesic is a medication that relates to taking away pain. Morphine is our go-to analgesic in emergency medicine. Our second one may be fentanyl. However, those are tricky now. That was a big step in the early 2000s. Nowadays, we usually keep the pain relief portion of our job or to the paramedics' pharmacological repertoire to morphine and maybe even Benadryl. And in some places, people are carrying Tylenol, believe it or not. For other things, we may use Valium or Versed or Ativan or something like that. That's usually for getting rid of seizures and psychiatric breaks, something like that. But in terms of pain relief, morphine is our analgesic. Cool term. Then there's all sorts of shorthand words that we once used when we would use hard copy patient care reports. We needed to fit a lot in on a very small section that we called the narrative. That was where you wrote in everything that happened on that call, everything you did, everything that went on accordingly, everything from the time you showed up, were you code 2 or code 3? Where did you find the patient in the house? What were they complaining of? What was their OPQRST? What was your initial treatment? How did you move them from point A to point B, that being the ambulance? Did you go code 3? What did you do in the ambulance? When you arrived at the hospital doors, you brought the patient in. How did the handoff go? Had to fit it in about 8 lines. We had a lot of abbreviations that we would use. Patient was a handoff for stated for OPQRST. We write them in. Then it became, we can put those in other places in the PCR. Nowadays, fortunately, we have these big opening accordion style electronic BCRs where your narrative can be 3 pages long. Doesn't even matter. Just all fills up in the section gets bigger and bigger and bigger. And then if you should print it out, you print out 5 pages versus 1. And if you need more copies, you print out more copies. Much more convenient for typing out specifics about the call. And because of that, we've gotten away from using abbreviations and symbols. And it's good. As you could see, there were room for errors with these symbols. Give you one exactly here that was always concerning. LOC for us means level of consciousness, right? There's ALOC, that's altered level of consciousness. However, if you wrote in your narrative, the patient had an LOC, what that meant was they had a loss of consciousness. So now we're even switching up the abbreviations. Morphine sulfate, the analgesic we give is MS. That's also muscular multiple sclerosis. So now you have 2 different abbreviations, meaning 2 entirely different things. And it only was dependent on the sentences that came before and after. And thus, it's much better to simply write the words out now. You will see more and more and more we've gotten away from abbreviations, from radio traffic that we call 10 codes, which essentially meant you could tell them if you were en route, on scene, having trouble, or in the bathroom even, by using a 10 dash number. And we've more or less gotten away from that too, simply for the sake of clarity. That's the same idea with if you're looking at symbols and things. And sometimes we draw hearts. Sometimes there would be images for alpha receptors, which was kind of this A shape that looked like the fish, like the Catholic fish, or the beta receptor, which looks like a sharp in musical writing. And the B with the thing on the side. Again, we don't need to use it anymore. So we don't. If you see it, remember it, write it down. You should have a little notebook with you at all times that you can use to scribble down interesting things you see. I find it even better than a cell phone. Cell phone, it's still distracting. And you still have to write stuff out. If you had a way of just on a simple piece of paper that you wrote stuff in and put it away, much better. Writing on your glove, much better. Remembering it is the best. And that's something that the youth should really shoot for, is starting to remember and retain information as you go on. You get this beautiful golden window from about 8 years old till about 48. Everything is perfectly put in its place. And then it all starts going out the window, I should say, to about 30, about 44 probably. Or you have head injuries, or you get gamma radiation, or you get something that starts wiping that stuff out. Start remembering the things, memorizing, be good to yourself. Use your brain. Your brain will thank you later on in life. Okay. And, have a brain and have a heart. That's all I got, gang. Hey, you've been beautiful. Thanks very much for listening. One thing to remember, use your regular life and draw upon that to remember this class, because in the end, it flips on you. And this class is all about real life, all about how you face real emergencies, all about how you remember what someone told you, because you link it to a term that you'd heard in the past. And you go, it was myocardial infarct, because you remembered the term from someplace else being used, and it all fits together, right? It's very cool. What are the 5 Romance languages? What do you got? Italian, French, German, Portuguese. What's the other one? Which one is it? French, Italian, Latin, Portuguese? I know what it is, and it's going to drive you crazy because just think romance languages. Just think romance. There's one more thing, but I'll leave that to you. Bring it up with me, and I'll give you a nice little Charms Blow Pop and a $5 gift certificate to Starbucks. All right, gang, get to sleep. I'm already crazy, and I can't wait to see you tomorrow.